Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello, everyone, and welcome to Sensei Podcast. It is my great pleasure to introduce our guest, Dr. Mohamed Ayoub from Bad Oeynhausen in Germany, one of the premier CTO operators in the world with great techniques and great skills and a great friend. Mohamed, thank you again so much for taking the time to be with us today.
Yes, thank you too. Thank you for having me.
Mohamed, you are very well known to most people, but tell us a little bit about how you learned and how you became such a great CTO operator.
So, it's a long story. So, when I decided to do my specialist training, so I was looking for a big center with a high number of PCI. So this was my goal actually, to be an interventional cardiologist and to get like good training in a good center. And after my medical study in Munich, so I changed to one of the biggest center in Germany, in Freiburg, and I attended there, and I was lucky to come into the cath lab after 4 years of my specialist training. And and I was there, and I wanted to be like a good interventional cardiologist. So at that time, I didn't know so much about CTO PCI, how is CTO PCI, but it developed by the time because it was the most challenging procedure at our center at that time. And we have got patients referred from everywhere in Germany to our center. I wanted more and more to do that difficult stuff, what other operators already in our center are doing it.
And then, so you started doing the cardiology in Munich, as you said. Did you always knew you wanted to be an interventional cardiologist, or were you considering other things, or it was always a passion for you?
It's interesting because I found that out after 3 years of medical study. I was living just near to the German Heart Center in Munich. It was like 2 streets from my home. And somehow I visited that center, and I was excited about how they are doing PCI. And it was 2006, 2007. So I got more involved into the research in the center. And so I was looking for angiograms and doing QCA for the research group there. And I found out this is very interesting what these doctors are doing. And one day, maybe I will be able to do the same. So this is how it started, actually. And
And then where you do your cardiology training? Was it in Munich before going to Freiburg?
Yes, it was in Munich. Yeah. No, cardiology training, I've done it in Freiburg. So just a medical study, I went to the university in Munich, and I did my research in Munich in the German Heart Center. And after that, so as I told before, I wanted to be in a center, a high volume center. And it was actually very funny because I was on the way at the train station. And I looked at the magazines at the central station, and we had the focus list. I don't know if you know it. So the focus list tells you which is the center on number 1, 2, 3 for the year. And I looked and at that time, it was Center Freiburg. It was on number 1. So I thought, why not to go to the center, to the heart center number 1? And I just applied for the center, and it was very easy to start there. And but I mean, I wanted to be an interventional cardiologist, and that's why I have chosen a center with a high number of PCI.
So I guess it's good to have your eyes open in the train stations, because you never know what you may see, and it might affect your life.
Yes,
I guess
yes. Somehow it was funny.
That's wonderful. And then, so you started there, and obviously there are many great operators over there. But still, from learning the PCI basics to becoming, learning the more complex stuff is quite a big step. So, what made you want to do the more complex interventions versus do structural, for example, or other peripheral? You have very strong program there for peripheral as well. So, what was your thinking along those lines?
So I was thinking about which is the most challenging procedure at our center. And I mean, for me, it was a CTO PCI, of course. So I was looking for other procedures. Okay, you can learn it, you can do it. But for me, it was the most challenging procedure doing at CTO PCI on a high level. And I mean, we had already high numbers. And when I started with in the cath lab doing interventions, my goal was to start as early as possible with the complex procedures. So I was not really interested in like doing regular PCI or what else. Of course, you need to learn them, but my goal was to go to the complex procedures as early as I can. And I mean, I could join to the complex procedures and CTO procedures already 6 months after I have started in the cath lab. I mean, I of course, it helped me a lot to be involved in all these complex procedures, and yes.
And then, what did you find the most difficult thing to learn? Was it the technique? Was it the hands, the thinking? What was the most difficult thing you found?
I don't know if I found it really difficult to learn, to be honest, because I came into the cath lab when I was 30 years old. So that means I started with the complex procedures and with CTO procedures when I was 31 years old. So, so for me, it was like if you learn basics for regular PCI or angiography. It was the same when I have learned the basics for CTO and antegrade or retrograde. So it was in the meanwhile, when I learned CTO PCI and regular PCI. For me, it was not difficult. It was maybe at the beginning, because I mean, maybe the most difficult thing was for me to be successful as much as I can during the procedures when I have done this by myself, because I knew we have already good operators at our center. And so it's not allowed to say like, okay, I didn't success the case because that and that. So I didn't allow that for me. So my goal was always to be successful whenever I was doing a CTO procedure by myself.
And were you nervous, or still? I mean, obviously you're doing very complex stuff and you seem very comfortable. Do you ever get nervous or anxious when you do these procedures, or how do you feel?
No, at all not. I was, of course, at the beginning, I was very concentrated. But I mean, it's not about being nervous. It's about more at the beginning, you want to be successful, but in the same time, you don't want to make complications. Because, if you start something new and you are not really known and nobody knows you, so you don't want to make complications at your early stage of learning. So this was my main goal, to be successful and in the same time not to make complications, because I wanted to do more and more in that field. But I don't think I was nervous at any stage.
And then you are doing now an amazing amount of procedures. So what brought you to Bad Oeynhausen, and how did you become so busy, and how does that work for you?
So, I mean, I was already busy before I came to Bad Oeynhausen because we had already a lot of procedures. And I mean, I changed my center. I came to Bad Oeynhausen before 2 years. And before I came, so I was worried about, am I really going to do same number of procedures and same complexity of procedures in my new center? So, but when I started in Bad Oeynhausen, so they had already an interventional cardiology, of course, and a good program for PCI, but no program for CTO PCI, at least not on that level, what we used to do. And we have a big department for surgery at our center as well, which is very known in Germany. And when I started in my new center, so at the beginning, so I started like I get a list with 80 patients, what I had to do. And this was like welcoming gift for me. And I had to finish all these patients during the first 2 months, and after that, of course, I've got a lot of patients referred from other centers from the north of Germany, and from the surgery department, because we are cooperating very well with the surgery department and my center, and we have heart team like we discuss always for the patients, which is the best option for the patient. Should we go for PCI, CTO PCI, or surgery? And on that way, I could develop a good program for CTO PCI with the high numbers.
Wonderful. And then you do obviously very complex cases, and some of them invariably will not be successful or complications can happen. How do you deal with those? Do you have any specific tips or tricks, techniques? Do they affect you? Do you bounce back well? I mean, how do you deal with that?
I mean, we all know complications can always happen. So it's not about not making the complication. Of course, we have rules. We should follow our rules to not make the complications. But even that they can happen, of course. I mean, always what I say, don't follow by the microcatheter if you don't know if your wire is really in the true lumen or subintimal at least, or don't push the wires in your collaterals, especially epicardial collaterals. So you should get at least some tactile feedback for your wires at the early stage of your training, which helps a lot during your career. I mean, we can find out a lot of things by the tactile feedback of our wires. So to feel, are we somewhere in the pericardium, or are we in the intimal or subintimal space? So we have many rules. We should follow them to not come to the complications. But even that, we can. Complications can happen. And what I always say, if you do complex procedures, so bleedings can always happen. And we know bleedings is the most complication what can happen during CTO PCI. So you shouldn't just stay there and look at your bleeding and say, okay, what should I do? You should stop the bleeding. So for that, you should be confident with how to heal and how to solve your complications. And I mean, I always compare that with the surgeon. The surgeon is always working and making bleedings, but he doesn't leave the operation and say, okay, there was one small bleeding and we will just wait up, maybe it will stop. No, they stop all the bleedings, and we should do the same. So what I always do, I always stop the bleedings by coils or whatever, but never leave any complication behind without treatment.
Wonderful. And then, as you said, you're doing such a high volume, which can be obviously very demanding, both in the time and the back and the brain and the sleep. So how do you keep yourself in good shape to be able to do this large number of cases?
Yeah, I mean, of course, it's hard work. I mean, many people, they ask me, so how are you able to manage all that high number? I mean, this year it's already more than 500 CTO PCI for this year. So they ask me,
Unbelievable.
So they asked me, it's already hard work, so you should care about yourself. And so I mean, when you love something, of course, so you do it without feeling it as a job. So and I'm still loving what I'm doing, and I hope it will keep like this, it will stay like this. And but so if you love it, so you give a lot of your energy, of your time, of course, and you don't feel it like a work, you feel it more like a hobby, or yeah.
But like, do you get any back pain? You know, these are long procedures. Do you use the rampart or any other symptoms for radiation?
Yeah, I mean, of course, it's always important to have a balance. So what I have done more in the past than now. So I was staying in the cat lab for 12, 14 hours, and after that I went to the gym to do some exercises which give me power for the next day. So I was just doing that for 3, 4 times in the week. Nowadays, because of time, less than before. But in my opinion, it's very important because it helps you not only for your energy. It helps you to have this mental concentration and mental force to do like 3, 4 complex CTO procedures on the next day, because you have to still free in your mind and to get that mental force. And I think if you have like a hobby or doing sport, it will help a lot, definitely.
So, do you lift weights? Do you run? What do you do for exercise?
So I was just doing like some training, bodybuilding at that time. I was in it, and running. Yeah, I mean, whatever you do, you should just find the balance for to get your energy for doing that hard stuff. Of course.
Now, do you ever find yourself kind of having a kind of an overload? So you do like your fourth case in the day. You've done 3 CTOs. It's your fourth CTO. It's late in the day. Do you ever find that you don't feel as I guess as lucid, as clear about what is going on, or you're able to maintain your focus and your concentration during all this time?
So I mean, it comes by the time. So for me, it's a training. So at the beginning of the career, of course, it was like 1, 2 case by myself. It was enough. And I mean, once you have done the retrograde approach or the antegrade approach or subintimal connection between antegrade retrograde many hundreds of times, so you will just become do it without thinking about what you are doing. So it's just like routine work. And I think it became like a routine work. Of course, there are a few cases where you need, if you don't have that many options for going retrograde or antegrade or ambiguous cap or something like that, something crazy with the patient, of course, or the patient is very complex at itself. I mean, if the ejection fraction is low, you need like support, you need to take care of the patient, of course, as well. But I mean, in the most of procedures, it's become like more routine work, of course, and it happens by training.
And how do you work with the same people every day, the same technicians, nurses, or you have your own team, or you work with anyone in the cath lab? How does that work in your center?
I mean, when I came to that center, it was for me important to implement the way how I am doing CTO PCI. What do I need on the table? Which approach? And everyone in my center is welcome to join me to the procedure. So I have always a nurse with me on the table, which is helping me like taking care of the wires, balloons, and whatever. And I mean, everyone is welcome, because I mean. If I want to achieve that high number of procedures, so I need a big team with me. And I think we are on a good way at my center nowadays.
Wonderful. Um, now you've teaching many people both in the meetings and in your center. How do you choose the people you want to teach? Do you look at their hand skills, or their thinking, their personality? I mean, how do you select the people that you help train in CTO and complex PCI?
So, I mean, I always say I want somebody who is doing the same like I have done in the past. So, who is like who loves CTO PCI, who wants to give a lot of things from his time and investing a lot in learning CTO PCI. This is for me very, very important because I have done the same. And I think if you want to be a good operator and maybe an expert on that field, so you have to invest a lot of your time. It's not an easy way, of course not. And I mean, if I want to invest my time as well in teaching somebody, so I need somebody who is persisting on learning CTO PCI, who always comes to me, never says like, okay, so now it's already 4 p.m., so I have to go home because, I mean, I need somebody who is all really wants to learn it, wants to give everything for that. And I mean, we have a lot of people. So I remember one student, she's a girl, she wants to do research, and she was sitting in my cat lab for 2 weeks, like just outside and looking at me when I was doing CTO PCI. And at one day, after 2 weeks, she came to me and she asked me, look, I mean, you went antigrade and retrograde, and you came subintimal antigrade because you knuckled down. So how is it possible to make the connection between antigrade and retrograde? And I mean, she is a student. She's still medical student. And for me, it was a sign, okay, she's really interested in doing CTO PCI, or in that field, interventional cardiology and CTO PCI. So I asked her, so you want to do like research? Yeah, of course I want, but there's no chance here. So, and she's now helping a lot doing research in that field. I mean, those people, so you can really, you can see it from maybe questions, from behavior, how interested they are in that field.
So the passion and the commitment, I guess that's the big part
Definitely.
for doing that. And what do you find the most difficult thing for you to teach the other people? Again, is it technique? Is it the mentality, the thinking? What is the hardest thing for you to teach the people who want to learn this?
I mean, the hardest thing is, of course, time. Because, you know, if you have like 4 procedures on your program for the day, so you want, of course, to finish the program. And I mean, it's always, I mean, if you want to train somebody, so it's not always about doing by themselves. That's what I always say. So if you watch something for 10 times, so you just need to do it 3-4 times, and you will be very good already, you know, for example. And I mean, this is the thing what I see. It's what I always say. It's not only about doing the procedure by themselves. It's about watching, of course. How do I go subintimal? How do I do the wiring of epicardial collaterals or septal collaterals? So, I mean, of course, it's much easier to teach somebody who is a little bit skilled than others. But I mean, everyone is able to be good, in my opinion, if they are interested and if they are investing time in learning that.
So, Mohamed, how many hours do you sleep every night?
So not so long, actually, not so much. So I sleep more at the weekend, to be honest, because during the week it's not possible to sleep more than 4, sometimes 5 hours per night. But for me, it's enough.
So you
For
make
me,
it up.
it's enough during the week.
Well, you seem to be always, on and alert and moving very, very decisively. So clearly, that's enough for you. I think for many other people, it may not be. And then, you've done this already, and you're doing obviously an insane amount of cases. But for people who are starting, how many cases do you think it takes for them to learn how to, to be good, not perfect, but good in CTO and CTO PCI?
So I don't know if we can define that in number of cases. I mean, some people just need like 50 cases per year to be good, or maybe other people need more. So it depends, I think, how many cases did you assisted already in the past. So because again, it's not just about doing the case by yourself, it's about the combination between assisting cases and doing cases. And then more cases you have assisted in the past, the less you need to do by yourself to become a good operator, in my opinion.
Wonderful. So, Mohamed, you've done so many things, created a premier program, doing a very large number of very complex cases with great success. What are the things that you are most proud of the things you've achieved so far?
So, I mean, you mean in my professional life?
Actually, both personal and professional.
Okay, so I mean, in my professional life, I'm still 37 years old, so I have a future for me. And what I want to share our knowledge and our techniques more and more to the people in Germany and in other countries. And I mean, I'm proud of our first meeting in Germany. It's going to be the German CTO and chip meeting for next year. We have established that meeting for us, and I will be happy to do more and more for that meeting and for other meetings as well, because it's our community. We need the community, of course, to push our topic and to push CTO PCI and to show people how safe it can be doing CTO PCI. And in my private life, so of course I'm proud of all of my family, because they were supporting me all the time, doing that what I want to do and what I love to do, and it's for me a big support.
Wonderful. And then, what is the most exciting for you going forward now and for the future? You've done what many people would consider to do many years later on, and you're already doing that already now. So, what is your things that you're excited about going forward?
So, I mean, maybe I think we should developing new techniques for CTO PCI, which makes our CTO procedures faster, because I see that it's not allowed nowadays to stay with a procedure like for 4 or 5 hours. In my opinion, it's sometimes a failure, of course, if we need like 4 or 5 hours for a procedure. So we should get faster and faster. And I mean, we get faster maybe if we develop new techniques, which helps us to get faster to the success. And this is one thing what could excite me in the future. But I think we should work all together on that.
Wonderful. I mean, definitely the room for simplifying them and to make the procedure more commonly, absolutely, that's something that can happen. But coming back to the teaching, you said before that passion is very important. But if you had to give some advice to people who are starting now, who are doing their fellowship or finishing medical students or fellows, etc., what would be your top advice for them to get good at doing something?
So they should still stay open to communicate with other operators about their cases, how to success a case, what should they do, like to be more successful in those cases, and to learn more and more about solving complications, because it happens, of course. And the most important thing is when I do a complex procedure and complication happen, to solve the complication without harming the patient. And I mean, this is something what they should learn more and more. And I mean, we have already a lot of meetings where they can attend, they can talk to us. We are all open-minded, and we can help them to improve them as well, and to involve them more and more in that field.
Wonderful. And then, obviously we've seen many amazing cases you've done online, but are there there's a case or go-to case or something that you really are you consider your best case that you've ever done? Is there a specific case that you really remember as being the best case that you've ever done?
No, to be honest, I forgot a lot of cases, because if you do a lot of cases and that high number, so you forgot the case what you have done like before 2 days. So, but I mean, I'm still, so my aim is always, my main goal is to be more effective, faster in doing the cases in an effective way. And I mean, the point what I face more and more, it's not just about opening the vessel and doing the CTO PCI. It's more about the complete patient, because we get many patients with a low ejection fraction, cheap patients, and you need to manage many things in the same time. I mean, this should be our goal for the future, how to manage these cheap patients, and in the meantime to do the CTO PCI, of course. And I mean, we have implemented that topic, how to deal with cheap patients, in our meeting in Germany, and we want to implement it more and more. And our idea was always also to involve surgeons as well, because we learn from surgeons as well how to manage this kind of patients. And I mean, this would be something what we should work more and more on it in the future.
Wonderful. Well, Mohamed, again, congratulations. Phenomenal work. You've really helped so many patients, taught so many colleagues, both in Germany, but also outside Germany. Are there any final words?
So, no, I want to thank you, first of all, Manos, for having me here. It's a big pleasure. And thanks to all of you, which helped us, of course, to implement that field and to make it easier and easier for a lot of people, and to increase our community for CTO PCI. And yes.
Wonderful. Well, thanks again. Congratulations, and look forward to seeing many great cases working with you in the future.
Thank you so much.
Thank you for listening to the Sensei podcast.